When we're seeing patients, we record large amounts of information in their records. The primary purpose of this is so that we can look after them. But all this information is also a valuable resource for research, as well as for the planning and commissioning of the NHS. When you see the patient in the diabetes clinic or for their hypertension review, the information that you gather is a powerful resource. Using this resource relies on the trust and goodwill of our patients.
The common law duty of confidentiality, which governs the use of confidential patient information, allows for its disclosure under certain circumstances. And one of these is where such disclosure is authorised following advice by an independent body called the Confidentiality Advisory Group, usually known as CAG. The key purpose of CAG is to protect and promote the interests of patients and the public, while at the same time facilitating appropriate use of confidential patient information for purposes beyond individual patient care.
We recognise that some patients will still not want their confidential patient information used, even when CAG has approved the use, and so they can opt out. Patients can choose to opt out securely online or through a telephone service. Patients do not need to do anything if they are happy about how their confidential patient information is used. They can change their choice anytime.
There are situations where information must be provided despite the duty of confidentiality. These include where there is a legal requirement, such as a court order, or when NHS England or the Secretary of State for Health and Social Care direct the provision of data under the Health and Social Care Act. In these situations, the National Data Opt-out will not apply. The National Data Opt-out will also not apply to anonymised data, or where a patient has given their consent to take part in a specific research project. To help you learn more about this, the RCGP has produced an e-learning module and a toolkit. The e-learning module takes about 30 minutes to complete and gives an overview of the purposes and implementation of the National Data Opt-out. The toolkit offers more detail and can be used as needed to learn more about specific aspects of the use of information and how the National Data Opt-out works. There are also a number of resources available on the NHS digital website.